This is the self-inflating bag, which can be found in the safety boxes in each BBI room, as well as in the bottom of the coat carts. This bag can be used to administer breaths without an oxygen source, but it is preferably plugged into 10 liters of oxygen. This bag cannot be used to give blow-by. It is mobile and can be brought with a patient off the unit if needed. When using this bag, give even breaths based on the patient's ideal respiratory rate. Stay in the green zone and watch for chest rise. The flow inflating bags should not be present on the BBI unit and are only used in the ICUs. It requires the user to plug in directly to wall oxygen at 10 liters. This bag has adjustable positive end expiratory pressure, or PEEP, and therefore can be used for CPAP or blow-by oxygen if needed. You need to have specialized training to adjust the settings, and this should be coordinated with the respiratory therapist. It is necessary to have the right size bag and mask for your patient. When in doubt, choose the larger bag size and give smaller breaths. The mask size needs to provide a good seal and should cover the mouth and nose, but not apply pressure to the patient's eyes. Use the EC grip to apply downward pressure to reach a seal, but gentle enough to not harm the patient. Inflate enough to see chest rise, keeping within the green zone. Always complete bedside safety checks at the beginning of your shift. Check that the box is intact and locked, and you have a 15-liter flow meter that is working correctly. If you are floated to the ICU, check the mask is set up and connected with the correct bag size and mask size, and then verify your bag settings and for leaks. If your patient requires rescue breaths, the code blue button needs to be pressed, and somebody needs to call a medical alert pediatric cardiac arrest. When others enter the room, allow a respiratory therapist to take over bagging the patient.